besides you guys. You can't answer this question. Give me an example of a patient you would do this with.
Would or would not?
Would.
You need to open certain parts of the lung up.
Okay. Give me a certain diagnosis that might occur with.
Would it be the emphysema? I don't know how to say it. The emphysema or whatever.
Emphysema?
No.
This probably wouldn't be the best for them because they're barrel chested already and already overstretched.
Pleurisy?
Segmental pneumonia.
Pneumonia. It doesn't even have to be segmental. But pneumonia, you can kind of, because what happens with pneumonia, you get congestion, it consolidates in the area, and they start breathing really shallow in that area so that they don't have to use it, okay, and they try to use other parts. So in your assessment, you notice that they're not as moving as much over here, and they have, during your auscultation, or during your immediate percussion, you felt like there was more fluid in that segment, or that lobe of the lung, okay, then that's where you would focus your treatment. You wouldn't do all levels that we just did. Okay, if it's the apical region that's not expanding as much, and that's where you hear the congestion, and because they have pneumonia, and that's where you're wanting to get more. Because think about it, if you breathe really shallow, and you've been sick, and you have a lot of congestion, and then you take a bunch of deep breaths, what happens? Usually.
I'm sorry, can you say that again?
When you're taking shallow breaths, and you're really congested, say like when you're sick, you start to breathe really shallow. What happens when you force yourself to take a couple deep breaths? Cough. It causes the congestion to move up. So if we can get them breathing deeper, then we can get that stuff up and out of their lungs, okay? Or they just could have something else going on where they're just not moving that well in that section, okay? Any questions about that? No, something else.
So to the people that we do not do this to, anyone with an incision?
Anyone with an incision, anyone with a rib fracture, osteoporosis is not a contraindication, it's a precaution. If for some reason you can't do that, say they have a sternal incision and they're breathing really shallow, but we want them to expand. Another way you can do this is just by placing your hands on the patient. See where you're at. So you're still going to place your hands in that area. You're going to say, okay, I'm going to place my hands here. Now when you breathe, I want you to concentrate on pushing my hands up and out to the sky. And then back down. Good. And up and out. And back down. So it's almost like the diaphragmatic breathing, but I'm giving her a little bit of a cue of which area I want her to expand. Now I can teach her to do this herself by having her place her hands there and know which area, which direction she needs to be, focusing on to get more expansion in that area. For the lateral one, because they can't really do posterior, and lateral and posterior can kind of go together with this, is I have the patients place their hands on the side of their rib cage, okay, right up, yeah, a little bit higher up, okay, right there. Now what I want you to do is concentrate on spreading your hands apart when you breathe in, and when you breathe out through your mouth, letting the hands come closer together, and then spread them apart. In and out. Okay, you're going to breathe in through the nose, out through the mouth. All right. Again, I usually don't have them do that if they're really concentrating on deep breathing 3 or 4 times and then have them stop, take a break, normal breathing. Same with the costal expansion. If you're going to do it a couple times in a row, they're going to change their breathing pattern for you. Okay, they're going to breathe deeper when you're thinking about it. So 3 or 4 times and then break. Okay. You can also use a sheet. This towel might fit around. A sheet or a long towel. Okay. They can do this at home. And I think it shows you in that chapter, if you've already read, that you'll be reading. But you can take the towel around, and that way you're getting the posterior and the lateral aspects, and they pull the towel like this, and their job is to separate the towel and pull the X and make the X smaller. Okay. In and out. Now again, if you can't do the quick stretch, you can also add a little bit of resistance. Now, of course, if it's a sternal incision, no. But if it's something else, it was just too painful to do the quick stretch. They have some infection in the pleural lining. They have that rubbing, that kind of thing. Then you can add a little bit of resistance, so when they start to breathe out and up, you're applying a little bit of resistance that they have to push against. Okay. It also may help them get the motion better. Okay, so you can add resistance. You can just have them feel and push you away, or you can add a little bit of resistance and have them practice that way too. Any questions about that? Okay, so go ahead. I'll give you 10 more minutes. Are we almost done?
30 minutes.
I'll give you 10 more minutes, 8 more minutes to practice that, and if you want to try some of the ones with just adding the resistance and having them breathe and practicing that way, go ahead and do that, and then we're going to do the last 3 things on your sheet. Okay? They all kind of go together, so it won't take long.